some concerns about the support that they should be receiving from the national government to fight the COVID-19 pandemic. And there were concerns earlier on that there would be a cut or at least a cap on some of the resources or to go to the counties. But Kennedy Morevi has been following that particular story and joins us now to give us an update on that and put things on the record. Actually, I'm told the update is currently on. Let's listen in.
The company are moving and people are able to get clean water. So our argument was that while the national government has a drop, also the same effect is at the county level. So if we reduce county governments, then they will have more problems than the national government. Furthermore, national government can borrow. They are able to borrow. They are able to get support from all over the world. While counties are limited, we cannot borrow, them they can borrow. So on that argument, and also, it needed some technicalities, changing the DORA, then changing the CARA, that would have taken quite a bit of time. And the fact that we have only 2 months to end of the financial year, then it was not really necessary. And I can tell you counties will have collapsed because for my case, when I looked at the reduction, it was going to be a full month disbursement that go to counties, which meant I would have got 11 disbursement instead of 12. And obviously, I wouldn't have managed to pay salaries. And then we had other commitments already. We had committed ourselves, you remember, at the beginning of the year, 3 months, we never worked when we could not agree on the division of revenue. Sasawa, yes?
You have talked about a pilot project.
There?
A pilot project.
Yeah.
To give vulnerable families 200,000 a month. And
no, not 200,000 a month.
2,000 a month.
Yeah, 2,000 a month.
Yes. And you have said $1 million have been earmarked.
Yeah.
When will be the full or the project going to be launched?
As I told you, this was through government, national government initiative. That's why they were using Nyumba Kumi to identify these particular people. And we have said they have carried out a pilot scheme in Nairobi here. And more so, pilot schemes will also move to the other partial locked down counties of Mombasa, Kilifi, Kwale, and of course Mandera. So, because that's where movement is very restricted. But these other counties, like our county, we are just preparing. Otherwise, things are going on normal, apart from wearing masks and making sure you don't spread it. So far, we are lucky. We have no case. We have no case in Kakamega at the moment. But you never know. That's why we are just fighting. So it's better we are ready with a number of people so that when the time comes, then we are able to roll out the program without any problem. But I think for the time being, they will target the partial locked down counties. Sawa. There is? Yeah. Yeah. Unfortunately, I don't have the names here. And I think next time, make sure that you have them here. But this can be checked today, and we can pass it to you. But I would feel that the northern counties, like Turkana, will need a testing center. Definitely, because Turkana, to drive up to this moment, the fact that there are no aircraft coming, it takes 4 days. So how can you be bringing tests to Eldoret, which takes 4 days? You can imagine. And we still feel that if they do mass testing, then we shall get more people. Maybe we still have a small number because of the level of testing is quite restricted. So can I now have...
Council of Governors Chair Wycliffe Oparanya there, talking about, among other things, the issue of austerity measures being taken on the counties, and at least the position they're taking is that there will be no reduction at all of resources that should be going to the counties. And this is especially as the counties face together the COVID-19 pandemic. Now, here in the capital, Nairobi, there seems to be some activity building up and some form of normalcy. Not, of course, anywhere close to 100% on what you would witness on an usual Wednesday during the week. But Seth Olale has been just following up the traffic and just seeing if it has some semblance of, getting back to some form of business in the streets. Seth?
Well, Mark, good afternoon. Traffic is slowly creeping back into the CBD, and I don't know how long or how much time it took you to arrive in the CBD, Mark, from Mombasa Road, wherever you came from, because today, as I came to the CBD, it took me roughly 20 minutes, and earlier on it would take me approximately 5 minutes. But the observation has been that traffic is slowly coming back into the CBD, and we have witnessed a number of increased motor vehicles. I'm talking about both private cars and public service vehicles, and this is just to maybe an indication that perhaps normalcy is returning in the CBD and especially in the capital. And this just shows you that, the wait might be over for a section of Nairobi residents who maybe had just taken some days off in the wake of the COVID-19 confirmed cases, which started on the March 13th. But what we have observed, and especially this week from Monday, is that there has been an increase in terms of increased number of vehicles, actually, especially in the CBD area. And this is attributed to the fact that many people, perhaps employees, had taken some leave days. Some of those leave days maybe have just expired, and now they are resuming operational. Same to the business sector, or rather the private sector, which is now resuming back after that particular break. And so this is just a scenario of what is happening here in the CBD. But even worse will be at that particular time at 4 p.m. when majority of employees, majority of staff from various companies and corporates will be leaving their offices and going home, or rather will be also leaving their businesses and heading home. We expect that this particular place where I'm standing in will be full of vehicles around me, and this is because each and everyone will be rushing to beat the 7 p.m. curfew deadline. But also remember, Mark, that there has been some regulations even in terms of making sure that the transport sector is in line with the measures that were put by the Ministry of Health. I'm talking about the carrying capacity of vehicles. What we know is that the private vehicles are supposed to carry not more than 50% of their carrying capacity. If you're talking about a 5-seater private car, that is not supposed to carry more than 2 passengers apart from the driver. And this is just some of the measures and the changes that we're experiencing both in the private and public sector. And of course, Mark will keep will keep Kenyans posted in as much as what is happening in the CBD in as far as traffic flow is concerned. Mark.
Seth, I heard you say 5 minutes to get to the office, and I hope you weren't trying to give the impression you live around the State House. We both know where you live, but I won't disclose your location. It is true that the traffic hasn't been as heavy, getting into town, and that is personal experience. But of course, things are not back to 100% in terms of the normal flow, whether human or vehicular, that you would see within the CBD on a usual week. But hopefully, we will be getting there soon. And yes, as much as you can, if possible, stay at home. And if you have to come into the CBD or move about, then definitely take all the precautions necessary. To another disaster facing the country, nearly 25 families have been displaced by floods in Kuresoy North following heavy rains that continue to hit the area. Some of the families are now camping at local public schools, and hundreds of others have been displaced across the country as heavy rains continue.
To carry only what matters to them most, many families trekked to higher ground following heavy rains that rendered their homes inhabitable.
Maji pia yamefurika eneo hiyo, na hiyo imekuwa hatari kwa maisha na afya ya wananchi wa sehemu hiyo, kwa sababu iwapo wataenda kukaa sehemu hiyo katika ile hali tuliona, magonjwa ikisuka itasababisha uharibifu mkubwa. Tutakuwa na magonjwa kama malaria, typhoid, bilharzia, dysentery na pneumonia.
Additionally, with the coronavirus pandemic, the families have been urged to observe social distancing in a bid to combat the spread of the COVID-19 virus. Unfortunately for the very same families, many struggle to afford and access masks due to the lack of employment.
Kwamba tutahakikisha kwamba watu wanne watakuwa wanalala darasa moja ili wa keep distance, social distancing, wafuate maagizo ya Wizara ya Afya.
Anita Nkonge, NTV.
The Kiambu County government has started fumigating hotels and restaurants that had suspended operations over the coronavirus pandemic. This comes after some hotels in Thika expressed interest in reopening their businesses in line with the Ministry of Health guidelines. Public health officers from Thika sub-county, armed with fumigating machinery, disinfected chairs, corridors, stores, reception areas, among other spots. At the Cascade restaurant that had sent home its 120 staff, the county officials managed to fumigate its 3 branches located within Thika town. Public health officers who were spearheading the exercise warned hotels and restaurants against reopening without following the measures announced by the health ministry. The fumigation was also conducted in all open-air markets, including Wangige, with officials also targeting bus parks and boda-boda sheds in order to improve on the hygiene standards in the county. The effects of COVID-19 are definitely evident across the country. And as much as we can see it more clearly in terms of businesses being shut, there is something else that is not quite clear, visible to the eye, and that is the effect on the social strata, or at least what is meant to hold us together as a society. And the National Cohesion and Integration Commission has been following the trends since the pandemic hit across the world, and especially here in the country. And we are now joined by the chairman, Reverend Samuel Korbia of the NCIC. Thank you for joining us this afternoon. Now, someone would imagine that, given the COVID-19 pandemic and the efforts to fight it, this has actually unified the country, in making sure that we contain it. But there seems to be some other findings.
Yes, it did. Thank you for having me. The very first casualty of COVID-19 is the social order that we are used to. The social order where people, of course, meet each other, shake hands, hug, etc. So the very first casualty was the social order, in which case then it challenges the very social cohesion about which, as a nation, we need in order to be seen as one people. The concern that we have is that the COVID-19 seems to be eroding the social fabric. And without the social fabric that needs the society together, then it means that the unity that we are seeking is shaken. And that is really the concern that we have. Because as you know, the social cohesion is a sense of being and belonging together to the same community, and engaged in a common purpose, facing shared challenges, yes, and accessing the same opportunities. All these now seem to be undermined by the COVID-19.
And as a NCIC, you have, raised the alarm in terms of a threat to the peace, security, and social cohesion. What are you doing then as a body to reverse this, or at least kind of fight it?
No, what we have done is we have created a committee on the COVID-19 impact on social cohesion. This is a committee that brings people with expertise in different areas that have to do with the social order. And we want to now study clearly and see what are the interventions that are needed. And one of the subcommittees that we have formed is on rapid response and interventions. And these are the ones that we are working on. For example, we know that when people are confined in one place for a period of time, they experience what is called cabin fever.
Yes.
Which is characterized by anxiety, by feeling hopelessness. And we want to identify and find out what are the Kenyans experiencing that can be assisted, particularly when it comes to psychosocial support that definitely are needed by Kenyans. So this committee is working, and it will complement the work of the National Emergency Committee on Coronavirus that His Excellency the President formed, so that there is a way of also addressing what I could call the social issues in the country in order to complement the hard issues of health and economy that the government is doing.
Reverend, over the months, of course, now the culture has changed in terms of how we relate to each other, especially in the public. And of course, we are hopeful that this will end, but there's the concern of stigma and the treatment of people who have recovered from this COVID-19 disease, and then also reintegrating them into society. What's your advice as the NCIC?
As NCIC, we are very concerned about the stigma. I have seen cases where people are being rejected even by their own relatives. What we want to do is to be able to pass on messages to Kenyans to show that coronavirus can be can be treated and will not test positive. Once they don't test positive, then it means that they cannot pass that to anyone else. And this is the confidence that Kenyans need to have. So what we want to do is to be able to work with different groups. We are very much in touch with the Nyumbakumi, for example, as well as the network, the government administration that reaches the people. We want to work through churches, through religious organizations with the messages that will help people to understand. So what people lack here is knowledge. And part of what we are doing is to make sure that we have evidence, we have facts that can be passed on, and it will show people that indeed they are safe with those who have recovered from COVID-19.
It is going to be a new normal, in fact, in terms of how we socialize, especially in public, going forward. And as much as we get over this particular disease, there are going to be some changes in how we relate. Do you necessarily see that as a danger to our cohesive nature as an African culture?
Yes, actually, what is going to happen is the new normal, it will take quite a bit of time before people get used to a new social order. But a new social order is inevitable during this period of COVID-19 and after it. Even when it is going to be behind us, it is very clear that the impact that is going to have on people, particularly those that will have had anxiety, will not know how to relate later on. This is going to be a major, major challenge. You know, in Africa, what keeps us united as a people is that sense of belonging together.
Yes.
And when there is this division, it is not going to be easy, but it can happen. It will challenge. It will not destroy completely, because I have seen that Kenyans are actually very resilient.
Yes.
And I want to thank them for that. So
right.
we need to know, how do we learn together, just as we are fighting together, because this is a war, and the Kenyans are the foot soldiers. In fact, all of us are foot soldiers in this war,
right.
because when you wash hands, you already equip yourself with an ammunition that is helping to fight the coronavirus. When you put masks in public, it's like putting a helmet.
Yes.
When you keep distance, so there are things that we are learning anew. This is the new normal, and for it to be able to become part of our life, then we need to accept it, and we need to appreciate the fact that life is not going to be the same after coronavirus
right.
and COVID-19.
Reverend Kobia, thank you very much, Chair of the NCIC, and still, even in this day and time of the social distancing, the National Cohesion and Integration Commission is still working to keep us together, figuratively speaking, that is. Now, speaking of figures, zero rating of charges on sending money worth 1,000 shillings and below through M-Pesa cost Safaricom 650 million shillings in March 2020. This was revealed this morning during the company's release of the four-year results for the 4 year ended March 2020. In the period under review, Safaricom's net earnings rose by 19.5% to stand at 73.7 billion shillings, crossing the 70 billion shillings mark for the first time. Safaricom has also revealed that it is venturing into the asset management business and is in the final stages of piloting a unit trust investment vehicle. Voice and SMS revenues continue to decline even as M-Pesa and data take a larger piece of the Safaricom service revenue pie. And with that, we take our first only break on NTV at 1. We'll be back with sports and more.
If we continue to behave normally, this disease will treat us abnormally.
Rashes again? Kiss Kids diapers. Kiss Kids, no rashes. Kiss Kids, no rashes. Bye-bye rashes. Buy diapers. Choose Kiss Kids.
Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. We admit both self-sponsored and government-sponsored students under the Kenya Universities and Colleges Central Placement Service. Join us today and train with the best to become the best. Mount Kenya University, unlocking infinite possibilities.
Maritime Tips, brought to you by Kenya Maritime Authority. Precautions for vessel and boat owners, operators, coxswains and passengers. Personal hygiene. Practice frequent hand hygiene, coughing and sneezing etiquette. Clean and disinfect frequently touched objects and surfaces on board the boats and vessels such as steering wheel, safety or guardrails and seats. Crew members, coxswains and passengers to regularly disinfect life jackets. Practice frequent hand washing with soap. Wear a mask on board a boat or vessel. Boat owners and operators to comply with government directives on movement restrictions within counties. Kenya Maritime Authority for safe and efficient water transport.
Basic protective measures as guided by the World Health Organization. Clean hands frequently with soap and clean water. Cover nose and mouth when coughing and sneezing with a tissue or flexed elbow. Avoid close contact 1 meter or 3 feet with anyone with cold or flu-like symptoms. If you have fever, cough and difficulty breathing, seek medical care early. Avoid raw or uncooked animal products. Help the world put an end to the spread of respiratory diseases by sharing this message with a friend. Message brought to you by Sour Herbal Family Bath Soap.
Welcome back. Leaders from West Pokot County have castigated the Rift Valley Regional Commissioner George Natembeya for calling off the search for 17 missing people following the flash floods and mudslides that claimed 37 people in Chesegon. The leaders say families of the missing deserve to know what happened to their kin.
The regional commissioner called off the search of the missing last week, saying it was impossible to retrieve any of the bodies from the debris owing to huge boulders and mounds of soil that had buried them. Natembeya instead laid wreaths on the banks of Chesegon River to mark the end of the search, a move that egged residents and local leaders. Speaking yesterday in Cheptulel, the leaders said it was wrong for the regional boss to stop the search before accounting for everyone.
Naona hiyo haikuwa sawa kwa sababu watu bado wana imani kwamba watatafuta na labda wapate mili ya wapendwa wao ili waweze hata kupata nafasi ya kuasika.
The leaders now want the government to rescind the decision and allow residents to continue with recovery of missing bodies.
Bwana Natembeya pamoja na timu yake. Ajabu ni kwamba bado watu 3 kutoka West Pokot hawajapatikana mpaka sasa. Watu 20 na kitu upande wa Marakwet mpaka sasa hizi hawajapatikana. Lakini anakuja juzi na kuita tu wale watu yake ambao alikuja nao kwa ndege moja na kuweka kitambaa hapo chini na kuomba na kusema kwamba sasa ya kutafuta mili ya watu ama kutafuta hao watu imefungwa. Ni nani atatafuta wale 20 na kitu? Nani atatafuta hii watu? Aliuliza nani?
The leader said that 56 people lost property of unknown value and a total of 152 were badly affected by the calamity. They lauded President Uhuru Kenyatta for allocating 400 million shillings to help the affected people from both West Pokot and Elgeyo Marakwet counties. Yes, sir. Judith Cherono, NTV.
Some concerns from the tea farmers in the North Rift region who have said that Kenya tea exports may dwindle on the international market if regulations proposed by the Agriculture Cabinet Secretary Peter Munya are adopted. According to the farmers, the 2020 regulations deemed to favor smallholder farmers undermine the role of the Kenya Tea Development Authority, which is a national brand through which tea from Kenya is auctioned. The farmers drawn from Trans Nzoia, Bungoma, Elgeyo Marakwet and West Pokot counties said KTDA brand is a big advantage to the 69 factories in terms of sale at the auction, and without the KTDA brand name, buyers will not be able to buy tea that they're not familiar with, they say.
KTDA ilitengenezwa kama authority, na wakati hiyo baadaye authority ikaondoka ikaletwa, sisi tukakaa tukabadilisha kuwa agents, ambaye imeendelea na imejenga factory kufika 69 vile ilivyo. Na tangu wakati huo hii factory zote 69 ni ya kusaidia mkulima mdogo mwenye half acre, mwenye pointi moja akiwa amepanda chai. Na wale large scale farmers, musikie mzuri, waandishi wana mambo yao, sisi na mambo yetu, watu small scale farmers.
The Deen Dayal Bhavan organization has launched a 100,000 face masks joint project by Hindu Council of Kenya and the Hindu Religious and Service Center. The masks are expected to be distributed to Kenyans across the country for free.
The officials launching the project briefed those in attendance on the importance of wearing masks to stop the spread of coronavirus. However, the aim of the mask project is to ensure that everyone has a mask.
It will go to the elderly people, it will go to the disabled people, it will go to the people who is unemployed and who is genuine. No money is we as a committee is spending for any personal use or for secretariat or transport or these or that. No. 100% money. In fact, we put money from our own pocket.
They gave the insight on how to prevent transmission and death from the virus. The 100,000 pieces of face masks will be distributed for free across the country. Elsewhere, Swan Carrier Limited, situated in Morocco, Machakos County, has donated 2 tons of foodstuff and other goodies to Mom Love Children's Home in Soweto, Kayole, and to Mirajul Redeemer Children's Home of Kitengela area. The food donation is meant to cushion the vulnerable from the effect of COVID-19. They have appealed for more donations from other well-wishers. Halima Gongo, NTV.
That's not the only helping hand. 20 million shillings worth of flour donated to the COVID-19 Emergency Response Fund will be kept at the Kahawa Barracks. The flour donated by Capwell Food Industry was received by Jane Karoko, chairperson of the COVID-19 Emergency Response Fund. So far, 1.3 billion shillings have been raised for the Emergency Response Fund, both in cash and in kind. The donations will be given to the country's most vulnerable during this pandemic, such as the elderly and those living hand to mouth.
We are going to utilize your donation to the needy and vulnerable people in our society. I'm hoping that from your example, you are the first one who came on board to support us, that we'll see a lot more donations in kind and in cash. And I'm hoping by the end of the week, we'll get to another next level. Our target is to get plus 2 billion by Friday.
Let's get a continental view now. Coronavirus has reached prisons in Guinea, raising the specter of outbreaks in unsanitary and overcrowded jails. And residents in Nigeria have welcomed President Muhammadu Buhari's plans to ease movement restrictions imposed late last month on 3 key states in a bid to contain the spread of the coronavirus pandemic.
Coronavirus has reached prisons in Guinea. Conakry Central Prison, for example, has a capacity of 500 inmates but currently houses some 1,500, according to Amnesty International. There were also earlier suspicions of prison infections in the former French colony. The Deputy Director General of Guinea's National Health Security Agency confirmed that authorities had discovered an infection in the capital Conakry's Central Prison. He did not specify whether an inmate or a guard had been infected, but said the agency had identified the measures to be applied urgently. Guinea, with some 1,200 confirmed COVID-19 infections and 7 deaths, is struggling to curb the spread of the disease across the nation of about 13 million people. Neighboring Sierra Leone has also recorded a positive prison case, the government said in a statement. Many healthcare workers in Egypt's threadbare hospital system must provide their own protective gear. So when a digital design company started 3D printing face shields, they gratefully accepted. Since the novel coronavirus first hit Egypt, medical doctor Yahya Diwa has been working all night shifts as head of an intensive care unit in a Cairo hospital. Around 100 COVID-19 cases have since passed through the hospital located in a low-income suburb of the capital, exposing staff to a heightened risk of contagion. The firm is now distributing around 2,000 face shields a day to medics nationwide and has partnerships with around 25 public and private hospitals. Madagascar police forced citizens caught outside without a coronavirus face mask to sweep pavements. President Andry Rajoelina has made it compulsory to wear face coverings outdoors in the capital to curb the spread of coronavirus. The new rule, which came into force on Monday, was announced alongside the gradual lifting of lockdown measures in the three main cities. Authorities warned that citizens leaving their house without face masks would face community service. Madagascar has 128 confirmed COVID-19 cases so far, with no deaths and 82 recoveries. On the walls of the Moroccan city of Saleh, Hamza Kehil paints murals that pay homage to the various professionals involved in the fight against the spread of the novel coronavirus, in collaboration with the neighborhood association that aims to raise awareness about the importance of wearing protective face masks. More than 300 cases of people infected with COVID-19 were detected in 3 prisons in Morocco after a screening campaign conducted in the 73 prisons of the kingdom. Morocco has 4,252 confirmed cases, with 165 deaths and 778 recoveries. The news that Nigeria's lockdown is to be scaled back is welcome on the streets of Lagos, where residents are waiting to return to work so they can afford to buy food. For some, even if they fear the virus, they say the lockdown will never work without more from the government to help the population. For a month now, millions of people have been ordered to stay home under the measures aimed at curbing the spread of a virus that has caused 1,337 confirmed infections and 40 deaths in the country. The restrictions have seen usually bustling streets emptied and taken a huge toll on the vast numbers of poor who depend on daily earnings to survive.
You run for Corolla, you suffer hungry inside house at the same time. So, you cannot work. But if people go to their work, at least they make a little, come back their home. Yes, sir.
Government can take care of their people. People will keep quiet. It's because they are not taking care of the people that people are complaining.
The King of Sanawi, based in the southeast of Ivory Coast, held a special ceremony seeking divine intervention to protect his community against the coronavirus pandemic. Traditional kings and local chiefs have great authority, and the event would normally have been attended by hundreds. But due to coronavirus restrictions keeping gatherings to less than 50 people, a handful turned up.
Now to the world of sports. The Directorate of Criminal Investigations has taken up the investigation into allegations by a Norwegian journalist that athletes in Iten have been using performance-enhancing drugs. The journalist posted images on social media of syringes purported to have been used and left at the Camarin Stadium. Athletes often train at the grounds and had done so just before its closure due to the coronavirus pandemic. Athletics Kenya challenged the authenticity of the images while noting that international media have often done such stories to coincide with major events. Kenya has been embroiled in doping scandals with the 2017 London Marathon champion Daniel Wanjiru, former world marathon record holder Wilson Kipsang, and former world junior 800 meters champion Alfred Kipketer suspended since the start of the year. The European football governing body UEFA has given the continent's leagues until 25th of May to decide whether they want to complete or cancel their seasons. Football is suspended in all European countries apart from Belarus because of the coronavirus pandemic. The Premier League has this week stepped up its plans to resume the season in what has been labelled Project Restart. Arsenal, Tottenham, Brighton and West Ham have opened their training grounds to players for individual work. The Premier League is hopeful of a potential 8th June restart and finishing at the end of July to fit in with UEFA's European competition plans. This will require full training to begin by the 18th of May. Well, it's good news in Spain, where professional sports people have been given the go-ahead to return to training from the 4th of May as part of the country's plan to get out of the lockdown. The allowance of individual training sessions is part of Phase 0, the preparatory phase of the schedule announced on Tuesday by the country's President Pedro Sanchez. La Liga has already sent clubs a detailed set of protocols to follow once training is allowed. Spain has been one of the nations hardest hit by coronavirus deaths, and the news of a possible return to sporting action came on the same day any such return was ruled out completely by neighbours France, where there will be no football played until September at the earliest. Formula One has almost doubled the shutdown period for teams as the coronavirus crisis continues to play havoc with the 2020 championship. The period factories must be closed for, and employees related to car performance away from work is now 63 consecutive days, which is up from 35. Teams began shutdowns on different dates in March, and the new rule means all will be closed until the end of May. The move comes 24 hours after F1 said it hoped to start the season in July. And that does it for NTV News at 1, but not for the news. It continues. We'll have an update at 4 o'clock, and as soon as the live update from the Ministry of Health on the COVID-19 status starts, we'll be bringing it to you live. And of course, another update at 7 and team coverage at 9 o'clock. So keep it NTV. Have a good afternoon.
Allahu Akbar, Allah.
During this period and always, bank different by avoiding interest in all your transactions. If not now, when? Ensure that all your transactions are free from elements of uncertainty and gambling by only investing your money differently. Bank on strong partnerships where generated profits and risks are shared by both parties. Bank different with Gulf African Bank. Call us on 0711 075 000 or SMS join to 21981. May God